All right, we're going to get started. Good morning. It's my pleasure to welcome you to today's webinar, One of These Things Ain't Like the Other, Exploring the HIV Prevention Needs of Young Adult Black Same-Gender Loving Men. My name is Dan Griffiths, and I'm the Director of the Gay Men's Sexual Health Alliance. The GMSH is a provincial alliance made up of HIV service organizations, researchers, policymakers, and advocates who champion the health of two-spirit, cis and trans, gay, bi, queer, and other men who have sex with men in our collective response to HIV in Ontario. Anti-Black racism is a public health crisis, and it's a queer and trans community crisis. The GMSH stands in solidarity with Black Lives Matter and in calling for an end to police brutality and injustice and the systemic racism in our institutions and society. And for us, that means being active listeners, being intentional, and leaning into our discomfort. We must also be accountable for our shortcomings, for when we don't get it right and when we do harm. The report that is the foundation of today's webinar was born out of what the GMSH heard from communities of Black, gay, bi, queer, and same-gender loving men. And through our efforts to increase the capacity of organizations to serve all in our communities, and in the production of sexual health resources, we're committed to creating opportunities that invest in the Black excellence and talent that's all around us, and to confront white supremacy and anti-Black racism. As it says in the report, same-gender loving men are telling us what they need, and it's now up to us as service providers and as a health system to listen, to learn, and to revise our practices. And so I hope that today's webinar provides you with moments of reflection and stimulates action in the important work that you do. And so I'd like to now introduce today's moderator, Eric Peters, the Manager of Health Promotion with the Gay Men's Sexual Health Alliance. Thank you.
Thanks, Dave. Good morning, everyone. I'm happy that you have taken the time to join us for this webinar. Just to let you know, everyone would be kept muted throughout the presentation, and I kindly ask that you hold all your questions to the end of the presentation during the Q&A. To begin, I'll present a brief overview of the agenda, followed by the land acknowledgement, then a bit of housekeeping. I'll give a brief description of the presentation, introduce the presenters, then open the floor up for Q&A. Finally, we'll close out the webinar. But before moving into today's proceedings, I'm taking this opportunity to ground this meeting by acknowledging the land on which we live, work, study, and enjoy social and recreational privileges. That it is Indigenous land, and Indigenous people have rights to this land. It is the traditional territory of many nations, which includes the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. By acknowledging this land, it represents an act of resistance against this continued erasure of Indigenous peoples and their rights. It demonstrates our relationship with the land and the continuous process of colonization that deeply impacts activist work. And it further recognized that treaties were made and broken, and some were never made. Rights were stripped, denied by centuries of laws and practices. Further to that, let's not forget the 2,800 Indigenous children who died while attending residential schools, and the findings of the missing and murdered Indigenous women and girls inquiry, which included two-spirit, trans, and non-binary people. As we are aware, COVID-19 continues to exacerbate structural inequities for marginalized communities everywhere. And many Indigenous communities will be far more gravely impacted by these inequities, thus making them more vulnerable, especially those further north and on reserves. So I encourage us to focus our thoughts and actions on mitigating the impact of this pandemic on Indigenous peoples and their communities. Finally, I encourage you to join us at the GMSH with our commitment to learning about Indigenous peoples, their history and culture, And collectively, let's seek out ways to ground our work in decolonizing approaches and practices, that we strengthen our efforts to respond to the 94 calls to action issued by the Truth and Reconciliation Commission and stand in solidarity with Indigenous people. Thanks. So moving into now, we will go into a little bit of housekeeping. So Chris is our tech person for the webinar, who will walk you through the process for the Q&A and if any technical difficulties during this webinar. Over to you, Chris.
Thank you, Eric. So letting you know, I apologize, the waiting room shouldn't be on there as we're using Zoom webinar as opposed to meeting. We still will not have any unwanted guests potentially coming in and sharing something that would be inappropriate. So this is a safe space. Everyone will be muted. Please use the Q&A feature to ask any questions. You can ask them at any time. However, it would probably be best to potentially wait until the end because the presenters may end up answering your question. It is just a matter of clicking on the Q&A and then typing your question in the box provided. Please note that we are recording this presentation for individuals who are unable to be here live, and we will make it available online. If you do encounter any issues at all throughout the webinar, please don't hesitate to call me. My phone number is 416-364-4555, extension 300, and I will do my best to assist you with the resolution of the problem. Thank you, and back to you, Eric.
Thanks, Chris. Well, to maximize time, we'll have the authors' bios up. We won't read them as they were also sent out with, they were circulated with the invite. Now for a little bit of background and context of this webinar. Our work at the GMSH is centered along the prevention, engagement, and care cascade. It helps us to understand and prioritize approaches in ending the HIV epidemic in Ontario. In part of our work, our efforts are focused on supporting gay, bi, trans, queer, two-spirit men, which includes racially diverse men, to help stay negative. In so doing, to better understand the HIV prevention needs of young adult Black same-gender loving men, SGL, which will be explained by the presenters during their presentation. Which explored the HIV prevention needs of young adult Black same-gender loving men. And in this presentation, David and Tyler will present the learnings and recommendations for service providers and organizations to help develop and improve HIV prevention strategies and programming in a way that honors the fullness of young Black same-gender loving men. So without further ado, it's with great pleasure that I welcome David Absalom and Tyler.
Thanks, Eric, and thanks everyone for taking some time out to listen to our presentation. So we'll just get right into it. So next slide, please. So in recent years, many players within Ontario's HIV sector, have come up with the narrative of potentially reaching an HIV endgame in our efforts to eliminate HIV. We've seen public health researchers, HIV advocates, and those on the front line set ambitious targets of ending the HIV epidemic in Canada by 2025, as published by CanFAR. So yes, with more than 30 years within the epidemic, we've made progress in developing HIV treatments that protect people's health and eliminate the risk of transmission. We've developed a clearer understanding of how the broader social determinants of health put people at risk and threaten the health and well-being of people living with HIV. And we've learned a lot more about how certain populations such as GBMSM, people who are using substances or injecting drugs, or ACB communities and Indigenous communities can be more impacted and affected by HIV in Ontario. However, despite this knowledge and progress, there is still quite a consistent dearth of literature throughout the epidemic within the Canadian context. So more specifically, there is a lack of data that strictly involves Black same-gender loving men, and also those who fit within the category of GBMSM and the ACB epi categories that are greatly affected by HIV. So, given the lack of data and the poorly collected data that does exist on Black gay or Black same-gender loving men, what we do know, thanks to the work of, Lana James and Todd Coleman's 2018 epidemiological report, is that Black same-gender loving men report a 8.5 times greater burden of HIV diagnosis when comparing us to the estimated proportion of Black same-gender loving men within the Black population. So, this long overdue epidemiological information about Black SGL men provides quite an important snapshot of the disparities that we can experience or that we experience. So really, despite this knowledge, and if we know that HIV is still disproportionately impacting Black same-gender loving men, along with other Black and Indigenous communities, it really starts to beg the question of who are we reaching an HIV endgame for, or who are we ending the epidemic for? Next slide.
Yeah, so David gives a really great overview of the state of affairs. So that last question is one that we're going to be emphasizing throughout our presentation. So an HIV endgame for who? So once again, trying to center the experiences of Black SGL men. So throughout the presentation, we'll be using the acronym SGL. It can be commonly understood as Black gay men. SGL stands for same gender loving, came out of the United States. It's a way that many Black gay men use to self-identify, and it's the type of language that we adopted for this presentation and that we'll be carrying forward, for the rest of our time together. So before getting started, I should mention that I'm in Ottawa, and this is the unceded and unsurrendered territory of the Algonquin people. So as we get further into our presentation, it will become understood that this project took place in Ottawa and Toronto. So Indigenous solidarity and local Indigenous, Black Indigenous solidarity is an important tenet and value that we carry through our work. So David gave a really great overview of the state of affairs, as I've said. So with that context of Black SGL men very clearly being left behind, David and I wanted to do something about it. So we developed this project coming out of a conversation that was hosted by the GMSH. So bringing Black SGL men from across the province together to talk about our HIV prevention needs, and really settling into the fact that HIV prevention is a lot more than a medical conversation. But as David touched on, it has to do a lot with the social determinants of health. So where do folks have housing, shelter, employment, and how does that impact our health outcomes? So in this project, we really wanted to touch on three main questions. So question one is we really wanted to explore the varying HIV prevention methods and toolkits that young Black SGL men use. So what we mean by that is we want to know how are folks preventing HIV in their personal lives. Secondly, we wanted to explore the key issues affecting the sexual health and well-being of young Black SGL men. And thirdly, we want to identify areas for improvement. So considering what we know, what solutions can we come towards? David met with or convened 15 Black SGL men in the city of Toronto, and I convened 7 Black SGL men in the city of Ottawa. So in the report, we collate the experiences all together, but it's interesting to note that Ottawa had a very immigrant African Black population, whereas in Toronto, we saw a lot of the folks coming from the Caribbean. So interesting to see that despite our different ethnic backgrounds, Blackness still led to many of the same barriers within the health system. Next slide, please. So today, we really want to share what did we find with this report. So we came together, we said we're going to do something, we designed a study, and now the time is to talk about what we found. So in this section, I'll be telling you about what we found about, or what we learned about the HIV prevention methods and toolkits of young Black SGL men. Next slide. So there were two central themes that we found that were shared with us by those who participated in the focus groups. So the first theme that I want to talk about is community resource and information sharing. So starting from the top, we really know that to prevent HIV, there are several methods and toolkits that people can invoke. Folks can choose to be abstinent, maybe not so common, but nothing wrong with that. There's PrEP, pre-exposure prophylaxis, that you're going to be hearing that word a lot. So that is a daily oral medication that folks can take every day, and it does prevent the transmission of HIV. And finally, condoms, something that folks are, aware of. So what does that look like? What does it look like for Black SGL men in trying to prevent HIV, practice safer sex? What does that look like? So what we found that the media played a huge role, and continues to play a huge role in informing how folks think about HIV, how prevalent folks in our community think it is, and we kind of coded that as worry. There seemed to be a lot of worry about HIV. And we can have a whole nother conversation about HIV stigma that we'll get to later in the presentation, time bearing. So we found that in the health system, there is a lot of neglect from health professionals towards our community. So understanding that someone is going in for a sexual health checkup, trying to get more information about their sexual health needs, and just really and folks in our community are really just not being referred to PrEP, for example. So what that led to is resource sharing within the community. So the takeaway here is that our community takes care of itself. So folks were turning to friends, turning to cousins, turning to friends of friends to understand, okay, so I am gay and no one's telling me how to get on PrEP. No one's telling me what sex looks like for us. So we take care of each other and we pass that knowledge through the community. A really striking quote that we wanted to share with you guys is as follows. So one participant shared that if I didn't have that friend who told me about it, who's to say where I'd be now, or how my sexual health would have been impacted had I not known that clinic existed, because I wasn't going to my family doctor. No way, no way, no way. So here we can see how for Black SGL men, the issue of coming out is really a barrier for health providers. And it works the other way as well. The issue that health providers are not always equipped to offer the kind of support and resource sharing and information that our communities need. So we really do thank our participants for sharing that. And I think it gives us a way to look into how anti-Black racism and homophobia play into, or heterosexism play into the experiences of Black SGL men seeking sexual health care from their provider. Next slide. So we talked about PrEP, pre-exposure prophylaxis, the daily oral medication to prevent HIV, and condom use. So folks talked about that a lot. So many of the folks actually in our focus groups didn't even know what PrEP was. So that's quite shocking, considering that health professionals, when you go in for an STI check, for example, should be asking the sorts of questions of, who are you sleeping with? Who are you not sleeping with? How often are you having sex? What kind of sex are you having? And from there, not only running HIV tests, but also educating or sharing information with patients. So seeing that, folks in our community weren't aware of PrEP should be ringing some bells of why is our community not aware of PrEP. And that brought us to conversations about health promotion strategies. So health promotion strategies are, the campaigns that let us know about different medications, whether it's the bus ad that you saw on your way to see a friend or on your way to social distance at the park, the bus ad that says get your flu shot, that's part of health promotion. So when we look at health promotion, we can think of it like marketing. So folks are thinking about who is going to be seeing this ad? Who is our audience? And what we found through the lack of knowledge about PrEP in our communities is that folks who are designing these campaigns are not always thinking of Black SGL men as the audience for which their campaign is intended. What that leads to is a lack of information in the community. So we saw low PrEP awareness. And secondly, we also saw issues of low PrEP access. So PrEP is a quite inexpensive medication. OHIP Plus in Ontario makes that medication accessible for thousands upon thousands of people. But those in our focus group weren't aware that it was a free medication available for those under the age of 25. So an important takeaway from this finding is that we can have amazing policies, we can have great things written down on paper, but if there isn't engagement with Black SGL men, those changes on paper are not going to translate into changes on practice. And they're most surely not going to translate into curbing trends of new HIV diagnoses among Black SGL men. So I'm not going to read all of these quotes for you today because we do have a limited time together. But for those who are interested, the report is available. The quotes are there to really drive home the point and hear from community, hear from participants about their experiences. But understanding that access to PrEP is an issue in the community. And what that leads to is that condoms usually end up being standalone preventative tools for Black SGL men. So moving forward, an ideal situation would be one in which health practitioners, health providers are providing the proper information, knowledge, and resources to Black SGL men so that PrEP and condoms can be used in conjunction with one another as preventative tools, or at least the option would be available to our communities. Next slide, please.
So moving on to the second section, for this area, we really wanted to start to explore like what were some of the barriers or the key issues that are impacting the sexual health and well-being of young adult Black SGL men. So very broadly, going into your healthcare provider, going in to get testing, figuring out what were some of the issues that people were facing and what were some of the things that were deterring them from even accessing care. So next slide, please. So some participants spoke to the difficulties in accessing and receiving care from their healthcare providers. The majority highlighted some issues around finding a primary healthcare provider to begin with, who they could be out to. A lot of participants, shared their healthcare providers with family members, and that created the anxiety around potentially being outed by their healthcare provider, or how much information their healthcare provider would share with family members. A lot of the times we found that some of the participants had a family physician that was of the same ethnic background, and in that case, had close family ties with the participants' families. So that really deterred participants from speaking completely openly with healthcare providers and leaving out pertinent information that could impact their sexual health care. So due to those issues and really the overall stigma to HIV and gay men's health, a lot of folks just did not have a healthcare professional, and they were either relying, like Tyler mentioned earlier, on their social networks to receive that information, or they were going without care. Some participants did find a primary healthcare provider, and they said that it took several tries to find the right fit, and a lot of them just found that when it came to speaking around anything to do with gay men's health, a lot of the time folks just were not fully versed or knowledgeable in gay men's health, and they were forced to essentially lead or drive the conversation when it came to those topics. So in more detail, some participants discussed the lack of knowledge that their healthcare providers had. And one participant spoke about his experiences on trying to go on PrEP with his family doctor. And he said, my family doctor didn't know what PrEP was. And I'm like, I shouldn't be coming to you with the answers. So then he's like running off the test and he's just like, oh, do you need this one? And I'm like, why are you asking me? So I would feel more comfortable going to like a specifically LGBT positive kind of doctor. So again, here we're seeing a lot of participants speak to being expected to hold that specialized knowledge around sexual health in order to access the appropriate care. And this was a common theme that we found across, where participants kind of felt the burden, this disproportionately placed burden on them to really be sexual health educators in themselves and have to advocate for themselves. And while it is ideal for folks to be able to advocate for their sexual health care, it should not be a requirement for them. So not only does this really create a unsafe practice for participants, but it also really creates this potential lack of confidence and discouragement for some young Black SGL men to really start accessing sexual health supports in the future. Next slide, please. So in addition to this, the theme around not being queer enough or not being Black enough was also prominent. So here we had a lot of folks speak to the experiences of homophobia, racism, and microaggressions when accessing care. So a lot of times participants spoke that when they attended non-Black organizations, they felt as though they didn't read as queer, so they didn't really receive pertinent information. So you know, a younger Black SGL man would attend or would enter like an ASO, and the person at reception would assume that they wanted to see the ACB worker, for example. So a lot of the times they just felt as though they weren't being seen. They, again, were forced to be that person that had to advocate instead of the folks working within the sexual health clinic or ASO, really creating a safe space for folks to really speak to what they needed in the space. So participants also mentioned that they felt as though when they did have the opportunities to share their sexual health experiences or their needs, that healthcare providers were expressing judgment or thought they were lying. So one participant spoke to how a healthcare provider didn't believe how sexually active he was because he was a Black Muslim, for example. So again, this idea of preconceived notions and judgments around folks based off of their race and ethnicity plays a huge part when young Black SGL men are attending any type of sexual health clinic. And then folks also spoke to the flip end of this when they were receiving care at Black organizations. They felt a particular type of discomfort that came from being easily read as being queer, and then as a result having to deal with the homophobia that came from staff there. So ultimately, a lot of these experiences spoke to the absence of culturally competent care. So we know the need for culturally competent care and how that will impact folks in receiving care. And we know that we know that providing care to young Black SGL men is not a one-size-fits-all approach, and has to be done in a respectful manner while understanding our needs and concerns. And this not only extends to like service providers, but it extends to the folks in the front desk and everyone within the organization. And without it, again, we're seeing how this can limit folks' access or their desire to access care within both like sexual health clinics and ASOs. So again, you can see how these experiences of, you know, microaggressions, anti-Black racism, and homophobia can really stick with participants, and it can really impact whether or not they're interested in receiving care in the future. Next slide, please.
So finally getting to the third part, we really wanted to not only talk about the issues, but talk about the solutions as well. So we wanted to identify areas for improvement in HIV prevention services for young Black SGL men. Next slide, please. So what we talked about in the focus groups was, all right, so considering this background, these issues, these barriers that are in no way fair, in no way right, how could sexual health services be improved? And in many different words, the overarching theme that came out of that question, the other overarching answer that came out of that question was around affirming spaces. So David just talked about not being queer enough for Black space or for LGBTQ2 organizations, and not being Black, and then not being Black enough maybe in other spaces that folks are trying to access care. So this really, before we jump into the nitty-gritty of it, is really about the identity group of Black SGL men. So one way in which groups are not able to have their needs met is when their identity is suppressed or omitted from the conversation. So as Black SGL men, if we're in spaces where we're in an LGBTQ2 organization where we feel uncomfortable or to talk about our race, to talk about our Blackness, where we feel like conversations around our Blackness are making folks uncomfortable, that's one way in which an identity that impacts our health, one of the social determinants of health, race, is being excluded from the conversation. Likewise, when we're in rooms that are for Black folks, and we feel as if those are not safe spaces to talk about our queerness, again, we're not going to receive the care that we need. So what our participants are advocating for are spaces where they can authentically and fully be themselves, and something that David and I believe that is an inherent right of everybody. So what do these affirming spaces really look like? So talking about how health services have to account for our Blackness and our queerness. They can be physical spaces, so going into an organization, going to events like this where we're talking about the intersection of race and sexuality, of Blackness and queerness. But also participants pointed to digital spaces. I would like to note that these focus groups took place before the COVID-19 pandemic. So within that context, this becomes a even more interesting finding. So what does it look like to have a digital space? And one person shared that if you were to create an Instagram page that was specifically for Black gay men, I feel like that would be really helpful for us. So that is what groups like the Black Gay Men's Network of Ontario are doing, trying to really build that digital community in the province of Ontario, so Black gay men can not only share resources and experiences, which is incredibly important, but where they can also feel affirmed in that they're not the only ones in rooms of folks who are not ready to deal with certain parts of their identities. Another participant shared that they really want a doctor. I want someone who's medically trained to tell me, okay, here are the advantages and the disadvantages. And here, if you have this amount of sex within this amount of time, I think this would be a good solution. But I really don't think that option is really being offered to us. And it's usually just word of mouth within the community. So we talked earlier about word of mouth within the community. So community sharing amongst us, which is super important. But this finding, I think I wanted to include it in the presentation because what this participant is asking for is essentially a well-working and efficient health service. They're asking for health services where you meet with someone, you tell him or her or them what's going on, and they're able to not only provide you with care, but provide you with the information to make good decisions, to make healthy, optimizing decisions in your life. And I think that that's what a lot of people in this country get. So when we're centering in on the experiences of Black SGL men, we should really all be questioning why this group is consistently marginalized by the health system. Why is this group consistently being forgotten? And I think that there we can start having more conversations around the ways that power and oppression navigate, not only within our society as a whole, but also within the health system. Next slide, please.
So one thing that we really wanted to include in this presentation and in the report was some action-oriented recommendations. So we really divided them into a general recommendation and then a suggested action to ensure that the result is successful. So the first piece is around engaging and working collaboratively with diverse young Black SGL communities to leverage cultural knowledge and amplify Black SGL voices. And then here we we said that the action should be to outreach, recruit, and hire from diverse young Black SGL communities. And one thing that we'd ask you to consider here really is to start to think through, like, how do you within your organization or your agency, et cetera, how are you currently thinking about how you engage, you recruit, and work with community? How do you work on amplifying those voices, and how do you do so in a way that doesn't leave folks within the community as being more or less peers, but instead equals in all of the opportunities? And then how are you really ensuring that the work that you're doing to begin with is culturally relevant and appropriate to Black SGL men? It's one thing to really say that you have a project and work on the project and then invite Black SGL men to the table later on in the process. But instead, why don't you think about how do we sit down with Black SGL men and build a table together? How do we work together to ensure that the work of your organization and agency aligns with the needs and desires of Black SGL men? And then for the second recommendation, increase the cultural competency and safety of service providers, working with young Black SGL men, both in the workplace and those who are clients. So this is a really timely, I think, recommendation as we continue to have conversations about how anti-Black racism pops up within all the elements of our society. And, we've seen that a lot of organizations and service providers have, especially within the HIV field, have the language to, speak to anti-Black racism and the importance of equity and inclusion, but it often stops there. Often we see that this language can be co-opted, and we often see how, even though we may have the well intentions, sometimes whiteness continues to be constructed and embedded as the dominant organizational culture and norm, and then we see how that can play out to service provision. So one thing that, if we are going to be using languages around anti-Black racism and inclusion and equity work, we need to think about how we can do that within your organization at all levels to then ensure that when it comes to service provision, that those ideas and concepts and values are also included. So again, like thinking through when it comes to doing this work to improve cultural competency from the agency side, like how are you ensuring that Black coworkers, and not even just Black SGL coworkers, but especially Black SGL coworkers, how are you ensuring that Black coworkers feel safe within your organization? How are you really working towards ensuring that there are learning opportunities and supports within your organization to stimulate conversations around anti-Black racism, to stimulate conversations around anti-oppression, learning and trainings, and having those discussions and reflections within your organization to then see where are the areas of change needed within your organization to improve the service provision to not only Black SGL men, but really to any, historically marginalized communities. And then the final piece on that is really thinking through again, what are the accountability measures in place to ensure that this work is sustainable, especially for folks that work in ASOs, like because of the high turnover rate, sometimes it can seem daunting to do this work, but there still needs to be measures in place to ensure that when you lose a one MSM worker, that you are starting as a part of the onboarding process, you're starting to have those conversations about anti-Black racism and anti-oppression learning, and you're continuing the process or the journey of ensuring that folks are doing these learnings and applying it into their work. So for that piece, we, our action was embed anti-oppression and anti-racism training as an onboarding requirement with mandatory annual refreshers. But again, thinking through some of those broader questions of how you can make it more sustainable. Next slide, please.
So here, for our third recommendation, we wanted to ensure programming and HIV strategies meet the specific needs of young Black SGL men. So there are many different ways of thinking about that. The ways that some possible actions that we want to put forward are, first of all, working with young Black SGL men and service providers to create culturally relevant education and support services. So the point here is that sometimes not on every team is there going to be the knowledge to be able to do all the things that we want to do. So it's one thing to have in your heart that, you know, as an HIV prevention worker, I want to reduce the number of HIV diagnoses amongst Black SGL men. I want to make sure Black SGL men are receiving the care that they deserve. I want to make sure that they're engaged throughout the process. So sometimes the knowledge is not always going to be there, but in our community, the knowledge has always been there. So working with young Black SGL men through focus groups is one way of doing it. Through in-person engagements or virtual engagements is another way of doing it. But the way that we are putting forward is through the model of co-creation. So making sure that those with lived experience, making sure that those in the community have an equal say in the services, in the designing of services that are for their community. So that equal playing fields, honest dialogue is what we're really looking for. A second action is making sure that our outreach program and programming efforts should be mindful and reflect the diversity of young Black SGL men. So although Black folks are united in our Blackness, we also have so much diversity within our group. So we have folks, for example, in Ottawa. Someone asked in the chat, what was one of the barriers to Black SGL men in Ottawa participating in the focus group? And one of those barriers was language. So obviously, like I'm from Ottawa, so I speak English and French, and we were able to, you know, have that conversation. But recognizing that not all Black people speak one language. Recognizing that when you have a lot of the Black population coming from the Caribbean versus coming from Africa, you're going to have two slightly different conversations. Recognizing that there are different elements of immigration status, of neighborhood, of class within the group. So sometimes when we have conversations about intra-group differences or diversity, we can sometimes get lost in it. But so I do want to end on the point that our Blackness is how we experience the world. And in the face of white supremacy, there isn't always a difference of so much of the intricate differences between us, but instead we are all going to experience white supremacy. And in that, we have a collective responsibility to self-identify and to talk about the issues that are facing our community. And I do think that we're able to do so as we're developing HIV response models to be able to have that conversation while at the same time honoring the diversity within the group. And thirdly, another action for ensuring that HIV prevention strategies adequately reflect the needs of Black SGL men is to identify and partner with specific champions. So to understand what's happening in your city, what type of communities are being built, what types of events are happening, where are people congregating, what are the issues that people are congregating around. I think that the future of HIV prevention outreach is going to be responding to the needs of the communities in which these strategies are supposed to take place in. There's no one clear-cut way of doing HIV prevention work, but rather to understand, for example, the ballroom community is, there's lots of Black SGL men that are participating, that are leading that are creating community. So what does HIV prevention work look like in that environment? Does it look like the white HIV prevention outreach worker going to set up a table? Maybe it has to look a little bit differently. And here is where we recommend working with Black community leaders, working with folks to get them on board, to get them to be able to talk about HIV prevention strategies and to share knowledge within the community. We've already seen throughout this whole project that we take care of ourselves, that for most of our participants, the ways in which we're learning about HIV prevention treatments like PrEP, the ways in which we're learning about doctors who are going to be able to understand our Blackness and able to understand our queerness, the ways that we're learning about where to get tested, how often we should get tested, the safety measures that folks take when they're going on hookups, like those, all of these things are being maintained by community connection, by community taking care of themselves. And I think that HIV prevention efforts, if the knowledge is being implemented in the community in a good way, that we will still be able to take care of ourselves, and we'll just be equipped to do so in maybe a more knowledgeable way if we work in tandem with HIV prevention outreach workers to reflect our needs. Next slide. So here we really want to open up the floor to any questions. That was a lot of me and David talking. And we really did enjoy doing this presentation. So maybe even before getting into questions, if there are folks who are on this Zoom call right now who shared their perspectives in this project, we want to extend a huge, huge thank you to you and say that this would not have been possible without you folks. And from there, yeah, any questions, comments, concerns, yeah, here to answer.
Okay, thanks, David and Tyler. This was a very informative and much needed presentation. I hope that this could stir some questions and comments or even feedback on the presentation. So the floor is open now. I see that there is another question already in the chat. I was hoping that I would allow Chris to monitor the chat, but we can also do it by show of hands. So Chris, over to you if you could monitor the chat too as well to see if there's show of hands. We could do both. So there is a question here now. The second question is, were BGL, who don't know? I think for ASO workers, do you see value in broadening our online outreach strategies to different dating apps than those currently used? I'll repeat slowly. For ASO outreach workers, do you see value in broadening our online outreach strategies to different dating apps than those currently used?
There's actually a bit of context that they provided underneath. We use Grindr, Squirt, and I believe a couple of others. But in my experience, these can be unwelcoming places to Black SGL men who are not out, and the overlap of these two. Any recommendations would be awesome.
So I can start with that one, Tyler. So I do think the idea of like online outreach using dating apps to be somewhat useful, but I do think that it has quite a number of limitations, and the first being that it can be quite passive. I think like regardless of the dating site that you use, like I think in the States it's a little different because, you know, you have apps like Jacked, for example, that are predominantly used by like Black SGL men. That isn't the same case here. So it doesn't necessarily put any additional value in broadening your online outreach strategies for dating apps. I would suggest, like we said in the recommendations, to move beyond dating apps and think through what digital spaces do Black SGL men frequent. So one thing that we said that's been really useful has been Instagram. So, you know, the Black Gay Men's Network has their online account on Instagram, but there's also folks like Trappy Hour, Reloaded on Instagram, Prepster. Like there are other means and other outlets that Black gay men use for digital community that I think would be more useful than making another account on a dating app. And in addition to that, we also know that when it comes to using dating apps, like you're not really reaching some Black folks. Like you're making the assumption that Black folks are using a lot of these dating apps when sometimes a lot of the connections that we have through, like when it comes to dating and things of that nature are offline, and it's through our social networks again. So I would stick with, you know, the same approaches that you're using, but I would think about expanding beyond online and dating apps. I don't know if you have anything you want to add, Tyler.
No, I think you hit the nail on the head. The only thing that I would add is, so from my experience before moving into policy, I coordinated Ottawa's only regional HIV testing program, and that was one of the strategies that we used, was using social networking apps like Grindr, Squirt, Scruff to talk about our services. One way that we overcame this barrier of making sure that everyone feels they can use these things is that we made sure that the pictures that we were using were always representative of BIPOC, SGL folks in some way, and also not having the same picture all the time, but using a different picture for all of our different clinic times. So if we're having a certain clinic in one of the suburbs of Ottawa, being able to know that this is what, like, this is a confidential and anonymous service was the first thing that folks wanted to see. And knowing that popping up with the same picture on the specific clinic dates was something that we found helpful, that I'm sure that you folks are doing that as well.
Excellent, thank you. There's another question here. Were BSGL men who don't speak English or French involved in this focus group? Where did they access services and support?
Yeah, I can take that one from Ottawa. So in Ottawa, we do have like a really immigrant population. So folks speak a bunch of languages, but no, people who participated in this focus group had to be comfortable in English to be able to share their experiences. Otherwise, it would just be, you know, me translating it for them, which isn't very good practice. But your second question of where can folks access services if they don't speak English or French. So I don't know how it is in other cities, but in Ottawa, there are dedicated French services. And we also work closely with our immigration and settlement services in the city. So from there, at Immigration and Settlement Services, you're able to access care, of course, in your language of choice to talk about whatever it is you need to talk about. So working closely with the HIV prevention workers, they're able to navigate folks towards French services if they need them, English services if they need them. Most of us working in the sector in Ottawa are bilingual English and French. And then there are services such as Rio, for example, that we can use and that I've had to use personally before with clients, where there's a third party who is anonymous over the phone who can translate in real time from a number of different languages, and folks are able to have conversations around the determinants of their health. So what brought them in to see me, some of their worries about getting tested, some of the resources that I want to tell them about, and having that middle person through that free service. Which I don't know if it's available in Toronto or other parts of the province, but it was very, very helpful, on the day of those meetings. David?
Yeah, the only thing that I would add so Toronto was very similar, like folks had to speak English to participate. And in terms of where to access resources, like I think OCASI, so Ontario Council of Agencies Serving Immigrants, would be a really great starting point to work with someone that does like system navigation to be able to better refer clients to where they need to go to access services. And I think most ASOs would have someone that they could connect to at OCASI to do some of that work. And then I'm sure that with like a lot of the ethno-racial specific agencies, they would have clients or they would have contacts too, but my number one recommendation would go to OCASI for some assistance.
Thank you so much. The next question is, can you expand on how to find doctors appropriate to refer Black SGL men?
I can go first there. Sorry, Dave, had you already started?
You can go first.
I was looking at the screen. Yeah, super briefly. So yeah, that theme of finding doctors who are appropriate, quote unquote, for Black SGL men was one that definitely ran through the experiences of those who participated in our focus group. So I'm understanding your question as what does it mean for a doctor to be appropriate for our community? So what that means is that I think one participant shared it on one of the quotes on the slides, which is that, you know, he was just saying that I really want to find a doctor who I can just say, this is what I'm doing. And that doctor can tell me, okay, these are the tests that we're going to do. And these are some of the preventative measures that you can incorporate into your lifestyle. So finding a doctor who can do that is difficult. It means that you need to have a doctor that understands, for example, some of the social determinants of health that particularly affect Black SGL men. So it's not that Black SGL men are experiencing disproportionate rates of HIV. It's not just because of their Blackness or their queerness. It's because of the system and structures put in place that make it so. So having a doctor that can understand, okay, I have a Black SGL man in my office and he's looking to get tested and he's told me about these different possible exposures that he's had, that we can have a doctor that can ask folks about questions like, all right, so where are you living? Who are your supports? Where do you usually find information about HIV testing services? Where did you hear about my service? Having doctors that are culturally competent in that way. Doctors that understand that you can't just run through a preset list of questions for everybody, but to understand that some different communities need different approaches. Ways that we do that in Ottawa is by leveraging community work that's already being organized by Black gay men. So keeping it 100, for example, is Ottawa's only Black gay discussion group. And then we also have the Black Gay Men's Network of Ontario. And both of those networks are being leveraged to share resources. For example, we'll get folks asking, hey, like, where do I find a doctor? I just moved here. I want to find a doctor I can be out to. So sharing that information through pre-established community initiatives or organizations like Keeping It 100 in Ottawa or Black Gay Men's Network from a larger provincial context.
Just to, Rui had clarified that he was wondering about how to find a doctor through word of mouth.
Okay. David, do you have anything else to add on how to find a doctor through word of mouth?
Yeah, like I think this is a very broad question. And I think there's a lot of pieces here. Like I think firstly, yes, like word of mouth within community is a huge thing that we've found when it came to like resource sharing. And I think one of the ways in which you can start to tap into that network is just because, you know, we don't have like unfortunately, we don't have like a running list of here's all the great doctors that we think you should be referring clients to. But again, going back to that piece around working with community champions, like that recommendation is really useful because then it allows you to start to tap into like the social networks of Black gay men. So then I would suggest firstly identifying within like your region who are some of the major community champions, who is a part of the network, and then being able to work with them to be able to start to learn or piece out more of like what are some of the resources that your organization needs, and then working with those community champions to broker some of those conversations. More largely, I think that this conversation about like how do you find an appropriate doctor just speaks to the fact that there is an issue within the ways in which like the current like medical curriculum does train doctors, because like we shouldn't be having this conversation of how do we find an appropriate doctor for XYZ community. Like every single physician that's trained should be able to be equipped with the proper tools to be able to do this work. So ultimately, like the upstream approach here is to start to think through what does the medical curriculum need in order to ensure the needs of the most marginalized are being served, and then how do we, as you know, first of all, like grassroots organizations, and then ASOs, how do we come together to advocate for those changes in the medical curriculum? And we're starting to see that work too, like through like Anye, like Nome from UFT, but those are longer solutions, but to answer your question about the smaller, like immediate solution, I would just suggest that you start to identify who in the community are some larger voices, and then have those conversations of like, what does your organization need in order to better serve Black SGL men, and then allow them to speak to community to figure out who's going to where, and what have their experiences been, and then to relay that information so that you have like a rolling list for Toronto or for Brampton or wherever that you can then refer to folks to.
Okay, thanks, David. We are over the 11 o'clock mark, and we have 2 more questions. So what we'll do, we will put those questions and send them out in emails once the presenters have looked at them. All right, so thank you again. Thanks again, David and Tyler. Thanks everyone for your participation and for attending today's webinar. I hope that there are takeaways that will be useful to you on your work, in addition to gaining a better understanding and perspective of not only the HIV prevention needs of young adult Black SGL men, but more so the barriers they face and the methods of engagement recommended from the findings that will hopefully result in improved programs, services for this population. I hope that you'd use the opportunity to provide feedback on today's webinar by commenting, by completing the evaluations that will be circulated shortly. Do enjoy the rest of your day. Thanks again. Everyone have a wonderful day. Thanks. Bye now.
Okay, thanks everyone. Take
Bye,
care.
guys.